We have a really important job to do in taking care of patients, but I'm also really passionate about taking care of the resident. We spend a lot of time, we spend a lot of years to do this work, and I think it's really important work, and I want to make sure that residents are supported throughout that process. We based our curriculum a lot off of Texas Health's main values, which is respect, integrity, compassion, and excellence. It's one of the reasons I chose to come here to work. It's because of the values and because I feel that the medical staff and the Texas Health staff live those values on a day-to-day basis. Learning the clinical aspects is especially important, but we need to keep in mind that residents are people. Physicians end up working a lot of hours, and we're very cognizant of that in this program. And so people have to have time to go home to their families or to whatever it is that they want to do.
The clinic portion of the program it's very important because in practice, a lot of physicians are likely to focus their career in that pathway. In our setup, the students get to rotate with us for a week at a time. So they get to really get in the feel of the clinic setting and get to be experiencing the flow of clinic and kind of what that exchanges with the patients, which is very different from managing someone who's acutely ill in the hospital.
We have some amazing space here. Texas Health Plano has provided us a lot of resources to really create a resident-forward space.
Northern Texas is a melting pot. We have influx of people in this area from all around the country, but also all around the world.
They're going to be trained really well, but they're also going to have a very diverse patient base. There is the clinical activity that happens where they are rounding one-on-one with their attending and getting that feedback. But outside of that, they have mentorship with their attendings.
All of the attendings that I've been able to work with so far have been really excited and really enthusiastic about teaching. A lot of times they'll take some time outside of rounds to just quickly go over a pathology, go over the management and treatment of certain conditions.
We also have simulation at Collin College. We'll be using their facilities. Outside of the didactics, we teach the business of medicine. We have a well-rounded wellness curriculum.
The wellness is in every facet of our program. You can see it in their schedule, in their learning, in all the different activities, simulation that we have.
We teach meditation and mindfulness, but other tools that will help people prevent burnout down the road.
A lot of our folks that come to residency, they have done the science part. And then there's an art of healing. So what we want to impart to our residents is the knowledge that they have, the science that they have, but also teach them the art of healing.
Every step of the process, there was so much support into our residency that it didn't feel like we were kind of pushed off into the unknown, and it felt very natural and comfortable.
Plano is really wonderful. There are a lot of restaurants in the area. We are close to Dallas, not very far from Fort Worth, so you have access to all sorts of different things. There are lakes around the area. It is a great place to also raise a family. The school districts here are really great. We're looking for somebody who is well-rounded, because that is what you bring to the patients. That is how you understand your patients really well, is by being that well-rounded person. So we want folks that are very dedicated to medicine, but they're very dedicated to their own growth and to learning as much about themselves and humans as they can.